Liverfluke infection in cattle and sheep is common in many parts of Europe and further afield. The fluke is a parasitic worm, Fasciola hepatica. Livestock become infected when grazing on land contaminated with Liverfluke cysts, Metacercariae. In order to survive, the parasite requires an intermediate host, a mud snail, which is found on damp, muddy, poorly drained land. The consequences of infection can range from sudden death through to acute or chronic disease in sheep and chronic disease in cattle. Economic loss due to ill thrift can occur even in the absence of obvious clinical disease. Liverfluke is a perennial problem in those parts of Europe that have conditions suitable for survival of the intermediate snail hosts. In the UK and Ireland, for example, with relatively mild winters and rainfall continuing over the summer period, snails breed mostly during the summer months, leading to a peak of infection during the winter in livestock. There are indications that in recent years the geographical range and prevalence of Liverfluke infection has increased. While the reasons for this are not entirely clear, they may be related to climatic changes such as recent relatively mild winters and to changes in land usage as a result of environmental protection schemes. Animals of all age groups are susceptible, and in areas where the climate is especially suitable to the survival of the intermediate host, such as Ireland, infection has been shown to be present in up to 80% of cows. Depending on the degree of parasitism, Liverfluke may cause meat production decrease up to 20% in cattle and up to 30% in sheep, and a decrease of milk production up to 8% in cattle. Severe infection may cause death in young animals, particularly lambs and kids. In addition, fasciolosis causes decreased fertility and wool production. In most cases of Liverfluke disease, infected animals do not show evident signs of disease, except anemia, and diagnostic tests are required to know if animals are infected. Current control methods are based on a combination of avoiding dangerous grazing areas and using drugs to treat infection. Currently, drugs are available that are effective against mature fluke only, against immature and mature fluke, and against early immature, immature and mature fluke. Veterinary advice should be sought on the necessity and timing of anti-fluke doses. Concern is growing over resistance in fluke populations to some drugs, particularly triclabendazole, which has been used extensively to kill early immature flukes. A consortium of scientists from countries around Europe and further afield have worked for the past 3 years to increase knowledge and provide improved control of Liverfluke infection for livestock farmers. The work has been in 3 main areas: understanding the climatic, geographical and seasonal factors involved in fluke infection, understanding how drugs work against the parasite, how the parasite becomes resistant, and finally, how the host's own immune system reacts following infection. This work has shown, for example, that the number of rainy days during the summer is a key factor in determining how much of a problem Liverfluke infection is likely to be in the following winter. Other factors increasing the risk include mild winters, a cool spring, and relatively warm summer temperatures. This information will be useful in developing more precise forecasting and early warning systems for farmers. Exact mechanisms involved in parasite killing by the drugs commercially available are still unknown. Work under the DELIVER project has shown that the exterior surface of the parasite is severely damaged when exposed to some drugs, and that parasites are resistant and not damaged to the same extent. The work has shown that there is more than one change that has occurred in parasites that have become resistant to drugs. These findings will help in the search for new drugs and in preserving the efficacy of current drugs. Cattle and sheep develop an immune response following infection, but unfortunately this does not do much to protect against Liverfluke infection. It seems that the fluke, like other parasitic worms, is capable of influencing the immune system to suppress protective responses against itself. It is possible that this may also affect the response of livestock to other infections present at the same time. These are factors that must be overcome in any attempt to produce a vaccine capable of protecting cattle and sheep against Liverfluke infection. In the DELIVER project, work carried out contributed to our understanding of these immune interactions. Some trials were also conducted on experimental vaccination protocols for cattle, sheep and goats. Although consistent protection was not obtained, there are some grounds for optimism that in the future, vaccination, in addition to drug use, early warning systems and land management may contribute to improved Liverfluke control and hence improved livestock productivity. For more information and to learn more about the work of the DELIVER project, visit our website on www.deliver-project.eu.